Good morning, this is Patrick Salzberger with Total Solution Partners. Picking up on our last video regarding the board and your culture of compliance. The OIG has given us guidance on where the board needs to be from a mental oversight perspective. And the number one element your board needs to understand is duty of care. What does duty of care mean from compliance effectiveness? It means that your board members need to act as an ordinarily prudent person would. They need to act in the best interest of the organization as a whole, and they need to understand the concept of reasonable inquiry. So we talked about a minute ago that some of your board members may not come from a healthcare background. That's why it's going to be critical to share the documents the OIG has provided regarding structural and operational questions with your board. Because embedded in duty of care is reasonable inquiry. And that's going to give the board the guidance they need to ask the questions of the compliance officer and leadership. How are we doing in these areas? How do we identify significant risks? What are our resource constraints? And how are we dealing with those resource constraints? So remember, when we're starting out, the primary responsibility for the board is duty of care in their oversight responsibility.